Hello everyone, welcome back to another video. In today's video, we are going to be talking about the treatment options for breast cancer by using medication. This is the Mammography Registry review. If you go on my channel, click on playlist. I do have other videos under the Mammography Registry review, but you do have to click on the playlist to get to it because on my channel I have other videos. I have videos on CT, MRI, work vlogs, daily vlogs. So just click on the playlist. Breast cancer treatments. So in this lesson, we are going to talk about breast cancer diagnosis, breast cancer treatment options, chemotherapy, and radiation therapy. In this section, we're talking about breast cancer diagnosis. Whenever patients come in and they find out they have breast cancer, we're going to talk about what made them go in, what are the treatment options for breast cancer using medication. The signs and symptoms of breast cancer is whenever a patient feel a lump in their breast or armpit area, inverted nipple or nipple discharge, change in their breast shape or size, redness and swelling of the breast pain, breast dimpling or skin texture changes. Now we're going to talk about how cancer is diagnosed. So on the previous slide, whenever I showed you all and told you all the signs and the symptoms, so whenever a patient do feel one of those signs or symptoms, or maybe even one or two, then they will call their primary care doctor or OBGYN, schedule an appointment to see them. And if the OBGYN feel it or primary care doctor feel it and confirm that there is a lump, or even if they cannot feel it, they will still order a mammogram and or a breast ultrasound. And depending on those results, then the patient will have to get a breast MRI. If something came back suspicious and they want to use breast MRIs to take a closer look. If you look at the top right hand corner, that's an image of an MRI machine. The patient is laying on their stomach, their breast is laying into the breast coil, and then the picture at the top is a picture of an MRI breast. This is an axial image. I perform breast MRIs as well. I am certified and licensed as or in breast, well, not breast MRI, but just in MRI in general. And my job consists of me doing a lot of breast scans. So we do a lot of those scans and we give the patient contrast to see the breast better. Let me all know in the comment box if you are an MRI tech or if you seen how it's done or if you know how it's done. I can make a separate video if you all would like. And then we also have the breast ultrasound, which is on the bottom right, or I'm sorry, the bottom left. It could be your right. And then you can also do the biopsy under mammography. So whenever a breast biopsy comes back positive, then the patient does have breast cancer. We have different testing and staging. You have your hormone receptor status test. This is going to check to see if the cancer cells have receptors for hormones like estrogen or progesterone, which can influence treatment options. And then you have your HER2 status test. This is going to check if the cancer have an overabundance of the HER2 protein, another factor that can impact the treatment. And then you also have other tests like blood work, bone scans, CT PET scans, MRI scans. I work in CT as well. So a lot of times whenever these patients are coming, they're checking to see if the cancer have gone to other areas of the body, and then they will get contrast if they aren't allergic to it. Now we're going to talk about radiation therapy. This is going to be used to treat breast cancer as well. Now, what is radiation therapy? So, it's a common and effective treatment for breast cancer, which it uses high energy rays or particles to kill cancer cells. It is often used after surgery to reduce the risk of the cancer returning, but can be used to shrink tumors before surgery, treat recurrence, or manage advanced breast cancer. And a lot of times, whenever patients are diagnosed with breast cancer, they have their lumpectomy and or radiation therapy, and they come in anywhere between 6 months to a year for their diagnostic mammogram. It'll be of both sides just to check to see how the surgery went, how the breast is looking, and we call it the we call it the lumpectomy protocol, and that's whenever the patient come in. A lot of time these exams is ordered as diagnostic, and then if everything is okay with the breast tissue, then the patient can return back to a screening mammogram. So your facility may call it something else, but my facility call it a lumpectomy protocol. And whenever these patients do come in, sometimes their breast is sensitive to the compression, so you always have to just come down slow on the paddle. Make sure that you aren't hurting them. Just keep checking to see how they are doing. It may be a little tender in that area. Their breast may feel a little full. You may even see redness on their breast. Now we have types of radiation therapy. We have external beam radiation therapy, the most common type where a machine delivers radiation to the breast, often 5 days a week for 1 to 6 weeks. We have your brachytherapy or internal radiation therapy. This is a tiny radioactive source. It's placed inside the breast near the tumor, delivering a concentrated dose of the radiation. You also have intraoperative radiation therapy. This is a single high dose of radiation is given during surgery immediately after tumor removal. You also have image guided radiation therapy. This uses imaging during treatment to ensure accurate delivery of radiation. You also have proton therapy. This uses protons instead of x-rays, potentially sparing more healthy tissue. And you also have deep inspiration breath hold. This is a technique where patients hold their breath to minimize radiation exposure to nearby organs like the heart and the lungs. Now, I will tell you all this. Whenever patients come in, they do not know which one of these therapies they have gotten. All they have, all they tell us is, I had radiation therapy. They don't go into details to say which type. They just say they've had radiation therapy. So just want to keep that in mind. Or want you all to keep that in mind. If a patient come in, they may not know which type they had. And to be honest with you, I've never had a radiologist ask which type they've had, but it is found in a chart. So a lot of times whenever these patients have these surgeries, it's in their chart which kind of surgery that they've had. So maybe that's why I've never been asked, did the patient tell me what type of radiation therapy treatment they had? Now, the purpose of radiation therapy is used as an adjuvant therapy, which is used after surgery to reduce the risk of recurrence. Neoadjuvant therapy, used before surgery to shrink the tumor. You have treatment of recurrence, used if the cancer returns in the breast or chest wall. You have your palliative care. This is used to relieve pain or control symptoms in advanced breast cancer. Now we're going to talk about the side effects of radiation therapy. Keep in mind, these are side effects from radiation therapy because later on I will talk about side effects from chemotherapy. So for radiation therapy, the side effects are fatigue, skin irritation, redness, dryness, peeling, thickening of the breast tissue, changes to nearby tissue, changes in breast shape or size. And if you all have already gotten to this point where you are taking mammograms on patients, let me know in the comment box if you have seen how any one of these side effects or conditions look on a patient that just had radiation therapy and have came in probably 6 months to a year to get their first mammogram after radiation therapy. Now we're going to talk about chemotherapy. This is also used to treat breast cancer. Chemotherapy is a common treatment for breast cancer that uses drugs to kill cancer cells by disrupting their growth. It's often used in cycles with treatment periods followed by rest periods to allow the body to recover. Chemotherapy can be given before surgery or neoadjuvant after surgery. adjuvant, or as a standalone treatment for advanced or recurrent breast cancer. I have seen or heard patients take chemo pills or they get the drug through the IV, because I always hear patients say, and also see it in MRI, where they sometimes they come in with a port so that they do not have to keep getting blood drawn or IV sticks. The side effects of the chemo drug is nausea, fatigue, hair loss, changes in their blood count. So these are some of the side effects. All right, that's it for this presentation. If you found this video helpful, please give it a thumbs up for me. Also, if you want to, you can feel free to subscribe for more videos. I do have a playlist on my channel where I do talk about other topics in mammography. I have patient care, I have physics, I have anatomy, I think I have two or three videos out now of review questions and answers. So just let me know if you want me to keep making these videos for you all. And I look forward to reading your comments. And thank you all for watching. Bye. I'll see you all next time.